everyone. Thank you for coming today. We're going to go ahead and get started. I want to start by thanking the OR Society for providing such a wonderful opportunity for so many of us to share our knowledge and insights with each other through this webinar series. And I'm so sorry, I just got a message in. And my name is Megan Crawford, and I recently accepted a position of lecturer at Edinburgh Napier University Business School. And I'm originally from South Texas, which is where I am right now on the coast, and earned a joint BA in psychology and philosophy from Texas A&M University, Corpus Christi, Master's of Science in Behavioral and Economic Sciences from Warwick University. And I am actually just a few days away from defending my PhD in management science from Strathclyde University Business School. I've consulted with Scottish government, charities, and worked for a branch of the DoD using behavioral insights and foresight work to help organizations and strategize for the future. Now, joining me today is my doctoral colleague, Stephanie Bryson, who will help field your questions today. So the way today will work is I will talk with you for about 30 minutes, tell you about our new project, and then there will be a Q&A at the end of my talk, which will last about 20 minutes. For everybody, there's an option on your Zoom menu for to enter your questions into a Q&A section and not the chat box section. And so when you put your questions in, Stephanie will be able to see them and help me work through them so I can make sure and answer as many of your questions as possible. There's an option to even upvote questions instead of entering them again. So the more popular ones should move to the top of the list. Okay, so this is great. Let's get started. We'll be talking with you today about using behavioral science to improve our responses to pandemics. And presently we are using the COVID-19 pandemic as our global study. So who we are. We've been using behavioral science methods to understand the behaviors and motivations of people across the globe during this pandemic. The project is the Survey of COVID-19 Responses to Understand Behavior, or SCRUB for short. The International SCRUB project is led by READY in partnership with BehaviourWorks Australia, as part of the Monash Sustainable Development Institute at Monash University, Effective Altruism Australia Research Collaboration, Australian Catholic University, and a group of more than 100 international researchers, such as myself, on this project. The core team is, whoops, I'm sorry, I'm like going through this too quickly. The core team is led by Alexander Seri, followed by Peter Slattery, Michael Nodal, and Emily Grundy. At the end, I will make all these slides available to everyone at the end of the talk, as well as there will be a video recording offered. So all these links that I'm sharing with you and all the information I'm sharing with you, you can access in your own time. And if you want to contact us or find out more information about our project. So the project actually started back in February, March time with a simple behavioral science effort from Alexander, Peter, Michael, and Emily. They asked people to take a simple pledge to perform basic but specific good hygiene efforts on a daily basis in order to protect those around us from spreading and contracting COVID-19. It was called Stand Against Corona. From this simple initial social nudge, a larger project began to develop in response to the growing infection rates of the virus across the globe. The project eventually came to be called the Survey of COVID-19 Responses to Understand Behavior, or SCRUB for short. SCRUB aims to provide current and future policymakers with actionable insights into public attitudes and behaviors relating to COVID-19. We are running a living survey with both repeated cross-sectional and longitudinal sampling running throughout the pandemic. In this survey, we track relevant protective behaviors, such like washing hands and social distancing, their variations by demographic and location, and their determinants. We also test interventions. Repeated data collection tracks behavioral trends and the impacts of country and regional responses to COVID-19. A global data set enables comparisons of policy responses and how effective they are on behaviors like staying home and seeking testing or using PPEs. The survey is modeled on the COSMO project, a WHO Europe initiative, and iCare, but also includes additional behavioral components. We are also collaborating with similar global surveys to share data and resources in order to minimize redundant data collection and encourage and aid ongoing rather than retrospective reporting. So, why use behavioral science as a tool to deal with a pandemic? For many, the narrative has focused on the surprise of the appearance of the latest coronavirus. But the question is this shock really warranted? With the timeline on your screen right now, we can see that in the last century alone, we have experienced about 10 pandemics. 6 of them have occurred in this century alone, though they didn't start in this century. Of the 10, 4 of them were caused by the influenza virus and 3 by coronavirus. And what this should tell us is that pandemics are 1, not that rare in modern history, 2, appear to be accelerating, even though the sample size is small, and 3, coronavirus and influenza viruses are the most likely ones to break out. And I think Professor Lauer put it best when he said, COVID-19 is not a black swan. It's actually a white swan hiding in plain sight, and we should not be surprised to see a novel coronavirus causing severe disease and capable of human-to-human transmission, and yet we are surprised. Therefore, if we're entering an age of widespread infectious viruses, we need to understand the best ways to mitigate their transmissions. A global response of this nature calls for a multi-front effort that addresses a variety of issues all at once. Ultimately, we all want to reduce infection and mortality rates. That's a given. But how do we achieve this? Well, we achieve it through the application of medical science, yes, but also through the individual and collective behaviors of everyone on this planet. Policy interventions like shelter-in-place orders don't directly impact COVID-19 cases or deaths. Instead, the link is behavior. Do we wash our hands? How do we wash our hands? Are we wearing PPEs? Are they quality PPEs? Are we staying at home? How often are we staying at home? Behavior must be measured to determine if and where these interventions are effective, which could be applied in other countries and regions differently or the same. We need to identify audience segments, the drivers such as awareness, personal motivations and resources, and barriers to performing protective behaviors. This is especially important considering the long-term prognosis of the pandemic and the need for sustained health behavior changes. So to date, the Australian team has launched 3 successful waves of the survey. We have collected responses from 56 countries with close to 2,000 responses in each of the 3 waves that have been delivered so far. My specific role began by helping to disseminate the survey, which then advanced in April to helping expand the survey into Peru, where I've been working closely with a colleague in Lima on a similar project, still in the early stages, using behavioral science and scenario planning to address the rates of iron deficiency anemia in infants and mothers. So with the Scrub project, what have we discovered so far? Well, first, we look at their behaviors. There is a wealth of information to be discovered from our work so far, as well as even more when our data are compared across other projects we are partnered with. So given our time today, I'm going to just give you a snapshot of what we're discovering so far. Now, the survey questions are all posed with a very specific temporal nature in the past 7 days. So the first behavioral measure is, in the past 7 days, how frequently have you taken the following actions to reduce or prevent infection with COVID-19? Hand washing for at least 20 seconds with soap or sanitizer is one measure we look at. Now, the data I'm going to present to you are divided by age groups: younger than 30 at the top, between 30 and 60 in the middle, and older than 60 at the bottom. The dark blue lines on the right stand for the proportion of responses that answered always to the question, and the red on the left stands for the never responses, and the yellow in the middle is sometimes. Today, I'm comparing just wave 1 data, which was in March, with wave 3 data, which is the most recent. So with hand washing, when we said how frequently did you wash your hands for at least 20 seconds in order to prevent infection spread, we can see that, well, I'll show you in wave 1, for the youngest demographic at the top, they appear to comply with this practice less than the older groups. So this is just marginally less. However, all groups show a drop in compliance with this practice by mid-May. The next question we look at is keeping distance. So this is a physical distance from people in the public, in schools, and in the workplace. And again, the data is divided by the youngest group at the top and the oldest group at the bottom, looking at just wave 1 and wave 3. And again, if we look at the very top line, we can see that the younger demographic appeared to comply with this practice less than the older groups in wave 1, as well as in wave 3. So that was in March moving into May. All groups show an increase, however, in this behavior by May, especially the oldest age group. So what this kind of tells us is that initially perhaps a success in the public awareness messages about the danger of infection and the means by which to reduce the danger of that infection was sinking in and communicating well with people. So the next one we look at is staying at home. We asked how frequently did you stay at home for the last 7 days? And looking at the 3 groups, again, the youngest group at the top and the oldest group at the bottom, we can see that the youngest cohort show the most compliance with staying at home in March, but begin to leave their home more often by May. And the older groups report at the bottom, the older groups report a slightly different behavior where they may be staying at home more often as time has progressed through the worst of the pandemic, but have not been consistent with self-isolating at home to reduce the infection rates. And then the final, one of the final little snapshots I want to show you is we asked people, how often did you wear a mask in the last 7 days? And just right away, we can see that the data almost completely reverses in nature. Their behaviors reverse in nature from the other questions. So looking at this, walking you through it, the data are showing that the majority of the people across all the groups from March into today are not complying with this directive as far as regularly wearing their face mask within the last 7 days. In fact, the majority responses are not at all, never. So further to this, the older groups at the bottom were the least likely to wear their face masks at the start of the outbreak. So that would be the 60+ group at wave 1. We had a proportion of 81% basically of our respondents said that they never wore their face masks in March. Then by May, everyone has increased their compliance with wearing masks, where the youngest group are practicing this the most. So that's the top box. Looking at wave 3, we can see the proportion shift from majority never wearing to a slight majority of always wearing. If we compare this to their home isolation behaviors, this may very well be a reflection of the fact that most people are staying home, therefore nullifying the need to wear a mask, which is more of a public effort. And as they are venturing out more, they're choosing to wear their masks more often. And I'd like to direct your attention specifically to the always and almost always responses of wearing the masks on the right side of your screen. Given that the CDC and WHO have repeatedly stated that wearing masks is more about protecting others than ourselves, and that the healthier young adults are more likely to be asymptomatic and carriers and recover, while the elderly cohort are at the highest risk of infection and death, we must if we must see a skew in mask wearing behavior, this is the kind of skew we would prefer to see, where more of the younger people are complying compared to the older people. However, the overwhelming takeaway from this particular measure is that the minority of people overall choosing not to wear masks. I'm sorry, I said the minority. The majority of the people are choosing not to wear masks. This is especially problematic when we see that people report leaving their homes more as time has passed. So now, Now that we know we have kind of a snapshot of their behaviors, we need to look at their primary and secondary drivers of their behaviors, because these are the kind of, this is the kind of information that really helps us inform policy and inform public health awareness campaigns. So of the minority who did not follow public health behaviors for staying at home, the #1 reported reason since April has been because no one else was doing it. So the way to read this chart is the top line is the younger cohort, the middle, and then the bottom line reports the proportional responses of the oldest group. And these are of the people who reported not staying at home within the last 7 days. And what we see is that they all give the exact same response. No one else is doing it. Of the minority, so the thing is, this is a huge insight. This one driver alone shows us that social norms are proving to be a far more powerful driver than any other driver at this time. When we look at why people don't follow the other health behaviors, we see a division of motivation by both age and sex. The younger and older groups almost exclusively report that they simply forget to do these practices, with a larger proportion being from the women. And the 30 to 60-year-old age group, however, is where we start to see dominating motivations like, I don't want to do it, and nobody else is doing it. So this is also the largest demographic to not follow prescribed social health behaviors. This age-sex interaction maintains throughout their secondary drivers as well. Everyone agrees that they trust their national health authorities the most for COVID-19 information. And unfortunately, right now, they trust the WHO the least. Trust in political leaders and distrust in social media both become a factor of age. And then overall, men are just less trusting in all the age groups. And that's particularly interesting because when it came to their behaviors, men overall were the least likely to comply with any of the requested health behaviors to prevent the spread of COVID-19. So as we dive deeper into people's reported behaviors, we see a pretty strong distinction between two classifications of the measured behaviors. We have new behaviors we're asking everybody to follow, and old behaviors we're asking everybody to follow. So of the old behaviors that we have on our survey, we're specifically is washing hands, which we do pretty much daily, if not daily, touching our faces, we do it multiple times daily, and covering our coughs, which we do regularly. These are basically can be seen as unconscious behaviors. But where these fall within the Venn diagram I'm showing you shows how they're valued slightly differently. People who report not touching their, or failing to not touch their faces, pretty much exclusively say, I just forgot. And washing hands, majority of the people say, well, I just forget. But there's a minority in there that say, well, nobody else is doing it. So they're showing this social norm sort of nudge in their reasoning. And then covering coughs, even more people say, the majority say, you know, I just didn't remember. But even a larger minority are saying, well, I don't see anybody else doing it, or I don't want to do it. So when we look at the new behaviors that we're measuring, those are staying at home and keeping 2 meters away from people. Now, even though we do kind of have, we all go home, so we all know to stay home, and we have practices of being 2 meters away or distance from people, these are fairly new requests on our behavior, and we have to be more conscious about them. And as we see, when people are asked to stay at home and they don't want to, they're not saying they forgot, but rather they're saying almost exclusively, nobody else is doing it. It's a social norm. And people who say they don't want to keep social distancing, the majority are saying, again, nobody else is doing it, or I don't want to do it. But there is a minority that say, well, I just kind of forgot. So of all the behaviors that have been introduced into our daily lives since the outbreak, the one that bears the least resemblance to our previous norms is wearing a mask. We all stay home for long extended periods of time. We have regular experiences like flu season where we practice distancing from others for the sake of health. But only a niche group of people regularly go about their days wearing medical masks for disease prevention. Therefore, with everything we've learned so far from our data, it would seem reasonable to predict that asking everyone to wear a face mask would be treated with the biggest pushback from the general population, with the reasons such as, I don't want to, with perhaps a compounding driver of no one else is doing it. So what can we do with this information? Well, from a public service perspective, this tells us that messages which promote our unconscious behaviors won't have the same effect on motivating us to adopt and maintain the more conscious behaviors. So taking everything we've seen so far, just from this one snapshot of our data, we could recommend, for example, campaigns to nudge compliance with public health practices, but they should come primarily from their national health authority. So the US should hear from the US, the UK should hear from the UK, Germany should hear from Germany, and so on. They should regularly feature people performing these new behaviors as a way to normalize them and step them into the social norms of our societies, particularly the newest behaviors, which is putting on masks to go about our daily lives. And public service announcements should ensure men are represented to help increase personal identification for the less compliant male population, because that is one thing that our data is showing over and over again that even seems to be crossing borders, is that men are less trusting and less compliant as a general group. Not all men, of course. This is an averaging of behaviors. And why is that? Well, most of it is because they're saying nobody else is doing it or they don't want to do it. So a final sort of public service guidance recommendation one could give in a consultation is we could even take a note from Cialdini's and Bicchieri's work by increasing the saliency of the message that everyone is doing it, or more specifically, everyone like you is doing it. So from a policy perspective, our collaborative work on the Scrub project has already been used to test Australians' willingness to adopt novel contact tracing apps to help lower infection rates. So far, the key drivers that have been measured for supporting or denying a government-funded initiative were high levels of information safety and autonomy in the form of personal information and surveillance. Now, our project helps policymakers better understand public responses to coronavirus, such as the percentage of people performing the protective behaviors, their attitudes towards the virus, and levels of concern. A second is the most effective interventions to promote relevant behaviors like targeting self-preservation, social proof, social norms, or empathy, and how these differ across locations, from the very local using postcodes, state and regional location, to more global, like at the national level, as well as demographics, which I've briefly discussed, between men and women and the younger and the older. So our data, along with joining it with other studies that are going on right now, will enable us to provide timely summaries to decision makers based on information at both the local and national levels. We might also be able to provide information on the associations between different variables as well. So for scenario planning practitioners such as myself, and I know many who are attending today, and those in strategy and foresight, there is a wealth of information that can be used from the Scrub project. Using the longitudinal data from our survey already, I am presently comparing the respondents' reported behaviors to those anticipated in hundreds of scenarios developed since January by governments and private organizations and NGOs. By cross-referencing the two databases, I will be able to help determine how many of the real-world outcomes were anticipated by scenario practitioners, and be able to map where the gaps exist in the scenarios. And such a combination of information can help teach scenario practitioners, just as myself, how to be less hyper-focused and think more broadly about our environments and help our clients think more broadly about our environments. And this is particularly poignant with pandemics, given the information I shared at the start of my talk, which is that COVID-19 outbreak is the 6th pandemic in just this century and one of the most popular causes for a pandemic, and therefore may even be considered, as was said, a white swan staring us in the face the whole time. With regard to strategy, we are using this project to expand across the globe and not only implement translated surveys to the new territories, but use the living part of our survey to work closely with national and local governments on developing further efforts. My team, for example, has been using these initial discoveries to aid our talks with the Peruvian government and the Ministry of Health. We have 2 to 3 teams at this time looking to expand the SCRUB study into South America. However, it is important to acknowledge that behaviors can be differently affected as much by social and cultural norms as they clearly are by age and sex. And because of this, we will be conducting several rounds of hypothesis testing with larger populations in different countries for cross comparisons and contrasting comparison. And finally, because this is a living survey, we have longitudinal data that is entering the 4th wave of collection. With this mounting data, we will begin working to develop better pandemic behavioral models. And this is a key move into the future given 2 things. 1, governments rely heavily on forecasting models to make decisions. And 2, as Professor Lauer pointed out earlier this month in a different talk, partly why we were caught by surprise by this 10th pandemic to hit in the last century is because nature seems to have found a way to interact with or hack our bodies in a way that our science and modeling has not been able to predict very well. We need better models, and we need a perspective, and we need a better perspective on a reflexive environment. So with this work, the Australian team will soon enter the next stage, which looks at integrating forecasting. So that is my talk today. That is a snapshot of our work that we have been doing. This last slide shows you a screenshot from our SCRUB dashboard that anybody can access. The data is open source. Please come on over, join with us, talk with us, collaborate with us, use our work any way you can to help advance our knowledge on not just the present pandemic, but also any and all future pandemics. So like I said, all the slides will be available after the talk as well as this recording. So thank you very much.
Thank you, Megan. Okay, ladies and gentlemen, my name's Stephanie Bryson. Let's cover some of the questions that we have received for Megan. Folks have been using their vote up buttons. Megan, a couple of questions here then. One is, was wearing a mask adjusted for availability of masks, and also was this adjusted for differences in messaging across countries?
Well, okay, so I'll answer the second one first and the first one second. The vast majority of the data so far is from Australia. So most of what we're looking at is focused on Australians, and we are working, the US is the 2nd largest source of data, I believe, followed by the UK and Germany. So comparing countries at this time and territories is still limited. But we're working on that. Now, was the question about wearing masks adjusted for availability of masks? Yes, it was. So if we go back to, I think I can take us back there really, really fast if I'm very good at this. Yes. Okay, hopefully everybody can see the what stops people from staying home. So we asked people what we asked what stopped you from doing all these behaviors, and so one of the options was I didn't have any access to it. Another option was I didn't know about this, and those the one response that was almost never chosen as a true response was I didn't know about it, showing us that everybody had some sort of knowledge of these behaviors. And I didn't have access to masks was not one of the highest responses. So this, we can't, know with absolute certainty everybody's motivations, but for those who chose not to wear masks, they did not say it was because they didn't have access to it. But this question was asked later in the survey, and that's one of the things with the living survey is we had wave 1 questions, and we learned a lot from wave 1. So we tried to we have a core questions that we preserve throughout, but we have adjusted the survey as we've gone on to reflect the gaining knowledge we have as the pandemic unfolds and hopefully ends. And so questions about wearing masks and why people didn't wear masks aren't as completely explored as the behaviors on your screen right now. Then that had to do with our unfolding knowledge. So if you want to know more, go to the dashboard, or you can download our data for free. It's open source. You don't have to like swear your soul to us or anything like that. And we can, and you can look more deeply into why people were not wearing masks. You can also come to us with suggestions on how to expand the survey, because that's where we have gotten some of our new questions and motivations and driver parts to our survey is people, other researchers on our team saying, you know what, now that we see this, we should be asking this. So we have a form you can fill out to submit for that as well. So I hope I answered your question on that.
Okay, thank you, Megan. Another question which seems to be popular is, are you tracking socioeconomic background?
I was curious about that myself. That's a very big one that you see on US surveys and on UK surveys especially. I'm not sure why why a full socioeconomic profile wasn't taken throughout, but now that I'm thinking about it, because I'm thinking in real time, we do ask for their salaries, we ask for their age, and a few other markers. We don't, I believe, ask for race, and the only two, and we don't really ask for gender, we just ask for sex, male or female. And these are things, if you feel, or if any of us feel that need to be modified, we can put in suggestions to modify the surveys as such. But I can tell you that other surveys we're collaborating with are asking those questions. And so by crossing our work together, we can, it takes more time, but we can build a more fuller picture, because we're trying not to have too much overlap in our surveys. Okay?
Yep, okay. Thank you, Megan. Another popular question. Have you considered capability, opportunity, and motivations that might influence behaviours?
And let's see, I can see the question here. Have you considered capability, opportunity, and motivations that might influence behavior? So people might be motivated, but they not be able to. Yes, that is exactly the slide you have on screen. That is only one of an entire host of questions we ask about. Well, it's one thing to say you did or did not comply with a social health behavior. It's a completely different beast when you say why you did or did not. Really, we're only asking the people who did not comply why they chose not to comply. And for some, it's they had no choice. And so those questions are on there. And I encourage you to go to our dashboard, which the link to our site is on the first and last slide. And again, you'll get this. Go to our dashboard and explore the data and see what people are saying as their reasons. Because we have, I didn't know, I couldn't, I had no choice, I didn't want to, nobody else was doing it. I think there's about 7 or 8 options we've given at this time. And then several of the questions that we have also have a free response. So if we didn't, you know, because no survey is going to be 100% accurate in offering you all your options. So that's helping us also more fully understand people's motivations.
Okay, we have another question here, and this is related to the behaviour of a politician who shortly after the lockdown travelled a significant distance to a family home. His wife was unwell, and he himself fell ill shortly afterwards. This politician did explain his actions and rationale to the general public. However, general public opinion seems to be that this individual contravened the advice. So the question is, based on that type of behaviour, what impact do you think that this high profile behaviour would have on the behaviour of the general public?
That's a really good question. And that's kind of the $1 million question, isn't it? What we saw on our, okay, so that takes us to one of our secondary drivers that we were looking at, which was, where is your trust in your government? Or which sources of information do you trust the most, I should say, for gaining accurate information from about the COVID-19 pandemic. And what people reported overall, that was independent of age or sex or location, were their national health authorities. So if I go back here and you look at this slide, that is, if your country's national health authority is telling you something, people are trusting that source more than any other source across the board. What people are trusting the least as sources of information are their coworkers. Now, in between there are our politicians and our local health authorities. And those kind of go back and forth. And we find that people trust their political leaders less for their information than they do for public health authorities or even the news sometimes, but they trust them a little bit more than their coworkers or family and friends. But when it comes to our political leaders consciously influencing our behaviors, we find that that is absolutely a factor of age. And the older people become, at least at this time, our older groups, the older we go, or as the data goes into the older age groups, the more the trust rises for our political leaders. So that really, if I were to say anything, his words might have more influence on people older than 60, more than his words have influence on people younger than 30. That's at least where the data is leading us to believe. Hope that helps.
It does. Okay. Next question. What models or informatics are behavioural scientists using that have caught the understanding, imagination of the public to promote the behavioural science viewpoint? For example, compare with the SIR model or the flattening of the curve, etc., used by epidemiologists.
That is a very huge question. I actually have on my desktop about 30 brand new articles, some of them in preprint. I think most of them are published, all discussing brand new models, all of them discussing new ways of interpreting existing models. I actually can't answer that for you right now, but what I'll do, and I'll make a note of it, is I will include these articles in my slides that I offer up to see if I can give a selection of the models that I've at least come across in both strategy and mostly scenario planning, as well as behavioral science, and see if that helps you out.
Okay. Next question. Do you plan to apply simulation for scenario experimentation?
Yes, that is actually what's coming, hopefully with wave 4. Then that is extremely important. That goes right down into the model testing. That will use more quantitative measures in like scenario planning, as opposed to the intuitive logics method of scenario planning. Hopefully we'll have some articles coming out, at least we'll submit them. Whether people want to publish them or not is something else entirely. But the point But that's almost not even the point, because one of the big efforts with this project and the COSMO project and the iCare project and the WHO is that we're trying to make all of our information that we gather and that we produce as transparent as possible and open source. So you have as much access to it as you could possibly get at this time, and in the future too. This is not time sensitive in access. This is in the future, because that's what science is about. It's about spreading knowledge and gaining knowledge from knowledge. So be on the lookout.
Okay, next question. This is about a standard methodological issue. Some people lie in questionnaires. Was there any attempt to validate responses? For example, has anyone attempted to count observations of mask wearers in the street? In early April, one individual was the only person on the London Underground with no mask. And then late in April, that person was the only person with a mask.
Within the survey, you're right, self-report surveys have their own methodological issues without a doubt. So just from a technical point of view, within the surveys, we have a number of attention checks and validation checks. Outside the survey, that's why we're collaborating with other projects. We are collaborating with, and we're cross-referencing what we can. It's a slower effort, but cross-referencing what we're gathering with what is being reported elsewhere. Observational data like that wouldn't really have much of a, it's more like anecdotal evidence, and that wouldn't have as it's not as robust of data as these other forms, but it's through our collaborative efforts that we're using the validation efforts and really just the standard scientific methods of surveys and data collection. And all of this, of course, is reported in every article and every manuscript that we're writing. Every bit has a limitation section, because just as important as it is to understand, say, the p-value or the proportional or the significance, it is also important to know where our limitations are when it comes to this data.
Okay, thank you, Megan. Another question. Did you control for the country effect? So, for example, in Belgium, the government managed to say that they weren't, that they were inefficient in the beginning, that's face masks, and then later folks were obligated to wear them.
Absolutely, absolutely. So when it comes to geolocation questions, we have, for the US, it would be as local as your zip code, and then all the way up to the national level. And the nice part about it being a living survey and building on longitudinal data from several waves is that we can retroactively go back, but we don't have to wait too long, and say, oh, we see these different trends from these two different countries, and we can retroactively compare that to the policies of the countries along the same timeline. And it is actually one of the more brilliant things. I hate using that word in this sense. I'm thinking like a scientist more than anything in this moment, but the amount of information that is open sourced right now and available, the amount just from the news alone and the information being covered is allowing for these compare and contrast and even these retroactive efforts to give much more clear information, as opposed to almost any other phenomenon and natural occurrence in nature, or what do you call them, disasters. So I cannot stress enough just how much information is available at our fingertips. We are drowning in it at this point. In fact, people are writing articles about how we're drowning in information at this point. So yes, we are controlling for that, and that control goes beyond just our survey.
Okay. Next question. Many of these responses seem to hinge on the perception of how likely a person thinks they will be infected and how ill they will fall. Are there any questions around this, as it seems many people assume that even if they get COVID-19, they will not be that sick?
That is a fabulous question. And I'm going to actually take you, we did ask this question and we've repeatedly asked this question. And I'm going to take you to the, I'm going to try and take you to the, what do you call it? The dashboard and see if I can show you an example of what we're looking at. So this is our dashboard. Stephanie, can everybody see my browser? Can you see my browser, Stephanie?
Yeah, I can see you.
Okay. Okay, so this is the dashboard. We have a little introduction for people who want to learn how to use it. I'm set on snapshot. We have snapshot or trends. And I'm going to go to, what was the question again? How likely they are. Yes, so future predictions. This is where we'll go. And we ask them, what do people think will happen if an average person in your community became infected? The next question is, if you became infected, what was your probability of dying? What is the probability that the average person will become infected? And what's the probability of you become infected? So those are the questions. And there's the box plot showing you the spreads. If you go to the left side of the screen, we have, you can see what we asked for wave 1, wave 2, and wave 3, which we don't have any information from wave 3 just yet. So I'll click wave 1 first. And then if you go down a little farther, you can see we can divide it by female responses. And, oh, I don't know why I need to reload that. That was really annoying. Let's go back. Perceived knowledge. So we've got male responses and female responses. Wait, that's perceived knowledge. We want to go to future predictions. So there you go. And we can see the difference between the sexes. And then we have it by age group. So we can uncheck all of these and see how the younger cohort thought versus everybody over the age of 60 predicted. And on one of the other pages, you can see how many responses came in from each of these groups. So how large our sample sizes are. I don't know why this keeps saying reload right now. They might be updating. So they might be updating the data to our dashboard at this time. But anyway, I highly recommend going to our dashboard and checking out the data. You can just watch it in real time.
Okay, there is a question related, Megan, to the previous question. And this was there any relationship with the perceived risk of COVID-19 to the individual based on age or health?
We do ask if people have already been infected, and if they were, are they still actively ill or have they recovered? We do have questions on that. We ask if they are in a high risk group or low risk group. Whoops, the question just disappeared. So I don't know where the question went, but I'm going to say, yes, we asked those questions and it's in the survey. And if you are a data scientist or if you want to explore the data, you absolutely can request access to it.
Okay, thank you. Okay, next question. Are you intending to consider analysing the data based on psychological theories such as theory of planned behaviour? And also, are you comparing with global cultural metrics such as Hofstede?
We do have a few papers in the works right now along those lines. In fact, I am leading one using or self-determination theory and using the data that we have to see if we can get a clearer picture on the 3 pillars of self-determination theory. There are a number of other papers that are looking at this, at similar theories like planned behavior. I'm not sure of anything being worked on similar to Hofstede. It's not a bad idea and something worth suggesting. And I mean, if you're down for it, you should talk to our leads and see if, because what we have is a lot of people threw in their suggestions for papers they would like to lead. And then a whole bunch of us also threw in our support for the papers that were suggested to say, oh, I'd love to help out with that. Or I already have some work in that, so I'd love to like co-author that, or I'll do the data work for that, or something like that. So Philip, if you want to join in, you can absolutely do that. I will also throw these in as suggestions for papers. I won't be leading them, so they'll be open for anybody who wants to lead or support. So thanks for that.
Okay, another question here from Venturino. Great work, Megan, and thank you. Forgive me for asking a naive question, but to what extent does public expectation vary between nations concerning their personal responsibility in managing the risk of transmission, e.g. human behaviour, and the R number, or the onus on government to act on their behalf, e.g. vaccination? It seems that some cultures may work more collegiately and altruistically than others.
That is a really good question. And again, this is the second $1 million question in today. There are a lot of people looking at this. Some of our questions do touch upon this, like I don't want to go back to the dashboard. It's a bit rough, and I think they're updating it. So I'm just going to go ahead and full screen this again. We are looking at, let's see if we can pull that up again. There we go. Let's see. Extent does public expectation vary between nations concerning? So we are looking at that with our trust and information questions. We don't have any ones that specifically say people expect their governments or their leaders to do things, but it is a really good tangential quality to the trust questions. And along with, we have started doing such things such as the study here with contact tracing technology that was specifically how to do with, do you see your government wants to do this, how much are you willing to follow it, and why do you want to follow it? And we were also testing messages, like what kind of messages appeal to the people about the contact tracing technology from their governments versus other messages. I'm not sure if that exactly answers your question, but we do, I'm like you, and I hold this hypothesis that different cultures, with different governments, hold different expectations and of both themselves and their society and their leaders. So this is exactly why we're trying to expand into South America and working really, really closely with the Peruvian government to get things started as much as possible, because what speaks for one group of people does not necessarily speak for another group of people. We want to say that, but we cannot say that with any kind of real accuracy without the data. So we're trying to get the data. So, and I see your follow-up, Philip. Thank you very much.
Okay, next question. This is from Val. Is there any evidence that behavioural nudges are more or less effective in different countries or cultures?
There's a lot of work coming out about that. That was almost like this second renaissance of behavioral science. So when the concept of nudging came out and got really popular after Kahneman and Tversky, a lot of people started treating it as sort of this monolith, the ultimate standard by which we could measure behavior. And then data wasn't supporting these hypotheses. And we came to find out that no, people are far more individualistic than the original work led us to believe. And so now we're in this sort of, like I said, a second renaissance of understanding that there are any number of differences, and not just cultural and differences and geographic differences, but even temporal differences. I am not the same like, for example, I may not be able to be nudged in a sense in one environment versus another environment, or with one group of people versus another group of people, because even things like personal identity shift along a continuum. So, or you could say a spectrum. So yes, there's lots and lots and lots of work coming out about that. And I know a lot of our studies and further ones will be including a lot of that literature review in there.
Okay, thank you, Megan. Next, I think the next question is more of a comment actually, but perhaps a fair one at that.
Just to interrupt, sorry, Stephanie, we're almost out of time, so this is probably going to have to be our last question.
Okay, so I think this is more of a comment. Hotter countries, climate wearing face masks is almost impossible.
Right. I mean, I get where Sam's coming from with that. I live in South Texas, where it runs between 25 and 35 degrees Celsius in the winter time, and with 100% humidity almost constantly. And clothing is very difficult, but it's not that difficult. And the masks, it's not like wearing, it really isn't affected by the heat here. Now that's anecdotal evidence. We also have, as I can see other people responding, lots of other countries in very warm and wet environments that also wear face masks, as well as jobs. When we think of clean rooms and things of that nature, they wear masks for hours at a time. But it can be a contributing factor to certain groups and certain societies being more reluctant and giving more pushback to wearing masks as a new daily practice versus other cultures. Like when I live in Scotland, I wear a scarf around my face all day, because it is just ridiculously cold there all the time for me. And that is no different than a mask almost. I mean, as far as like having a face covering. So I can understand that. And that is why we ask people, after we ask them what their behavioral trends are, what their motivations behind those behaviors are. Because it may very well be that location and ambient temperature become a major motivating factor that no one was really wanting to acknowledge before.
Okay, thank you, Megan. I assume that concludes the question and answer session for today.
Mm-hmm. Yeah, it's 8 o'clock, and so I defer to the OR Society at this point, but I just want to say thank you, everybody, for coming today. This has been really wonderful. I love your questions. I love that we have the questions recorded, so I can take these and we can make our work better based on your insights and your knowledge sharing. So thank you so much, and everything will be available for you as fast as I can get it to you.